Alright, now for the next drug of choice, we get to look at what? The Lomustine. Okay, let me clean this thing. Yeah, very much more bright now. Okay, so let me on my light. Alright, nice. Okay, so this Lomustine is also known as what? Ceenu, alright? We could say Ceenu. So this Lomustine, you can see this is what? Lomustine capsules. So we're about to look at the pharmacology of this drug. So looking at the pharmacology of this drug, we are going to do it under the mechanism of action, the pharmacokinetics, the clinical uses, and adverse effects that you should actually expect when you are using this drug. Okay, so this Lomustine, it's interesting to know that it's actually what? A chemotherapy drug. All right. So this Lomustine is a chemotherapy medication which is used to what? Treat various type of cancers, including cancers like brain tumors, the Hodgkin's lymphoma, and the rest. Okay. So what is its pharmacology? We said that it is an alkylating agent of nitrosourea type. So it works by alkylating DNA and RNA. So this will lead to what? Cross-linking and damage of the genetic material of cancer cells. Okay. So this process, the total process, will inhibit DNA synthesis and cell division. Okay. And it will ultimately lead to the death of the cancer cell. So for the pharmacokinetics, for absorption, it is rapidly absorbed after oral administration. For distribution, it is highly lipid soluble, allowing it to cross the blood-brain barrier. It is widely distributed in body tissues. Metabolism, it is metabolized in the liver to form active and inactive metabolites. Alright, so the drug and its metabolites are primarily excreted via urine, with a small portion excreted through feces and lungs. Alright, so the elimination half-life of Lomustine is what? Approximately 16 to 48 hours for its metabolites. Okay. Clinical use, just like we said, is used in treating what? Primary and metastatic brain cancers, as well as Hodgkin's lymphoma. Alright, that has progressed following initial chemotherapy. That means you employ this drug when you have done chemotherapy but it has failed. Alright. Administration is typically administered orally as capsules. Alright, adverse effect when taking this drug can be expecting things like bone marrow suppression. So this can lead to things like leukopenia, reduced white blood cells, anemia, reduced red blood cells, thrombocytopenia, reduced thrombocytes or platelets. Okay, so it could also cause nausea and vomiting. Alright, so other side effects include hepatotoxicity, pulmonary toxicity, and more secondary malignancies are also possible when using this drug. Okay, so that's it for the pharmacology of what? Lomustine.